morning all. Dr. Kim is doing great job. Normally what happens in conferences, for each session there is a chair, co-chair, and sometimes reporters at the national or international level. He is doing all job for all the persons together. We are highly grateful to him.
We don't have time. We're too busy, aren't we?
But at the same time, he is introducing all the speakers. But he has not introduced the persons who are there behind this conference. I think so. Chairperson for ARCC Journals, Dr. Poonam Goyal, and Managing Editor of ARCC Journals, Gaurav Goyal. I am also have brought association with them since the last more than 20 years, being editorial board member, editor, and associate chief editor in Indian Journal of Animal Research. So without taking much time regarding that, I will today start with my work on 3 decades of veterinary parasitology research, especially talking on parasitic diseases in which we are all involved, whether those are humans, animals, wild animals, or at the same time environment. We are discussing since yesterday more about agriculture, more about bacterial and viral diseases, which are prokaryotes. We have not discussed regarding the parasites. So I will give a basic introduction about parasites, which are basically eukaryotes with well-developed, well-defined nuclear membrane. Normally, with the passage of time, when they are there inside the host, they harm the host. Their reproductive potential is more than that of the host. And as far as parasites are concerned, they will be inside the body, internal parasites, and outside the body, external parasites. Internal parasites, most primitive, are single-celled protozoa, and multicellular elements may be most primitive are cestodes, followed by trematodes and nematodes. As far as parasites are concerned, no species is immune to the parasites. Humans, domestic animals, wildlife, all are vulnerable to the parasites. That's why we need to have a unified One Health approach to tackle with them. Among the parasites, arthropods, which are external parasites, are comparatively, maybe ticks, flies, lice, mosquitoes, they are more dangerous because they are carrying the pathogen from wildlife to livestock to humans. Hence, there is one way approach to deal with them together. Who can get the parasites? Why this time we all know the parasites, all of us, whether those are humans, those are wildlife, can get the parasites. But as far as parasites are concerned, it's difficult to tackle at one level. To tackle or deal with the human health, you have to think about the animal health, but at the same time, animal health is dependent on various environmental factors which are interconnected. Further, environmental factors are interconnected to the climate in relation to vectors, hosts, and parasites. Climate change is fundamentally altering the parasite dynamics through the 3 main routes, especially the environment related. Warm temperature, which increases the vector breeding potential, external parasites especially. Increased precipitation in the environment is favorable for the developmental stages, where at the same time, increased humidity is responsible for prolonged survival of the pathogens. So, as far as One Health approach is concerned, parasites or parasitic diseases exist at the convergence of animal health, human welfare, human health, and environment. Why these parasitic diseases they matter? Because they are affecting as zoonotic diseases in human health. And as far as economic impact is concerned, related to agriculture impact, animal welfare is there, then environmental factors are very, very important. Effective control of all these parasitic diseases need One Health approach. We need to come together, whether we are veterinarians, physicians, environmentalists work together, focus on a single sector, leave majority of gaps if we work together, don't work together regarding prevention and control of these parasitic infections. As far as what we have learned based on our studies since the last more than 3 years, 32 years, based on our publications, citations, index, and our work has been recognized, teamwork, across 17 countries, across 5 continents, including Australia to Canada, China to France, New Zealand to USA. The global reach demonstrates that parasitic diseases are a universal challenge requiring shared solutions. What we did during these 32 years, livestock diseases and productivity losses due to these diseases, vector-borne epidemiology, zoo and wildlife parasitology, anti-parasitic. Yesterday we were discussing about the antimicrobial resistance, but this is another important issue, anti-parasitic drug resistance, which is an emerging issue, diagnostic innovations and molecular techniques. So, as far as vector-borne and zoonotic diseases is concerned, parasitic diseases, our key focus was on epidemiology of vector-borne diseases. Why it is so? Because understanding transmission dynamics related to vector-borne diseases are very important. As the parasites are not limited to one place, they are changing with the changing environment. So vector-borne parasitic diseases demonstrate that perfect intersection of animal health, human health, and environmental factors are very, very important. Seasonal variation, climate change. Normally we see that due to environment change, such and such seasons, such and such diseases are occurring. But as far as climate change is concerned, there is change in the dynamics of the parasitic diseases. The areas, especially which were free from certain parasitic diseases, now those areas are having those type of parasitic diseases. And at the same time, some of the vectors, especially in heights, were not available in previous years due to climate change. These are occurring now. Hence, climate adaptive strategies are not optional anymore. They are essential for survival of livestock system and protection of human health. So we need to work on these issues. As far as anti-parasitic drug resistance is concerned, current issues related to not only single, but multi-drug resistance have great impact on productivity. Hence, there is a great issue as far as anti-parasitic drug resistance is concerned. It threatens the long-term viability of livestock production systems. So, we cannot depend on a single medicine or single way to take out the diseases or disease problems. We need to integrate the approach by total dependency on drug dependency to make their maintaining effective control of all these drugs. Diagnostic innovations are very, very important. Why? Because the diagnostic innovations are game changers. From microscopy to molecular techniques, whether these are molecular techniques or they are advanced microscopy scanning or otherwise species differentiation or precise parasite microscopy, they are game changers because early and accurate diagnosis transforms parasite control, enabling targeted treatment rather than blanket treatment, reducing cost of the drug because 80% of the parasites are present in 20% animals. Especially if we think about the small ruminants, sheep and goat, you need not to treat all, you have to think over these lines. Reducing the cost, reducing the residues are very, very important, and minimizing the drug use and detecting anthelmintic resistance at early stages is important. As zoo animals is concerned, we conducted a great research, especially on the zoo animals and wildlife. comprehensive surveys, we have seen that the zoo animals, they are sentinels, they are guards. Because to track the emerging and re-emerging parasitic infections. Why it is so? Because there is spillover of the infection to domestic animals than to the humans. Zoo animals, as sentinels, are emerging parasites, threat the potential of these infections. Hence, the wildlife health today predicts livestock and human health challenges tomorrow. We need to think over these lines. Integrated approaches are very, very important. Whether it is chemotherapy or farm, pasture management, immunization, though there are little vaccines against parasites as compared to bacterial and viral diseases, wherever they are available, we can think it over. As far as the traditional practices is concerned, ethnoveterinary, biological control, vector control is of course very, very important to cut down the life cycle of parasites and exploitation of host resistance. So this is the most important, current and most viable approach, integrated parasite management, because it is sustainable, reduce the dependency of drug and drug pressure, and works with natural systems rather than only dependency on the drugs. So IPM, integrated pest management, as we are discussing, have been proven to reduce the 30 to 50% of dependency while maintaining or improving the parasite control. Basically, these IPM are economically viable, environmentally sustainable, and help to preserve drug efficacy for future generations. As far as we can think it over all, but at the same time, who will do it? Capacity building is very, very important. Whether it is researchers, they are veterinarians, or they are public health specialists, nurturing the next generation towards One Health is very, very important. Human capacity building as well as infrastructure. Based on all these things, based on our research, actionable strategies for the policymakers that are to develop integrated national parasite control programs rather than depending on drug efficacy or drugs only, invest in diagnostics, early diagnosis, early management, more productivity. Surveillance system is also important. Support into disciplinary research, One Health initiative, taking into consideration veterinarians, physicians, environmentalists. For researchers, focus on climate adaptive parasite management strategies are some of the areas those are free, but free are getting the parasites. Investigation on alternate control methods, reducing the dependency on the drugs, and strengthening wildlife, livestock, human environment at the same time as interface studies. For practitioners, adopt evidence-based integrated parasite management, and at the same time implement regular monitoring and efficacy testing, collaborate across veterinary, agriculturists, and public health sectors. For farmers, recommendations or strategies, embrace sustainable grazing and housing practices, seek professional guidance for treatment rather than doing their own. As we were discussing regarding the farmers, they are illiterate. Today they are not illiterate. As far you check on the Google, 80% or more of the farmers now in India, they are literate. They, based on their practices, sometimes they are doing better than the specialists based on their experiences, based on their knowledge. So participate, incorporate surveillance programs. Farmers is concerned. Parasite diseases management exemplifies One Health principle that is requiring integration of human health, animal welfare, agriculture, sustainability, and environmental protection. As far as key takeaways are concerned, parasitic diseases significantly impact productivity and food security. Number one, climate change, as we discussed, is altering parasite transmission patterns requiring adaptive strategies. Drug resistance is a very big issue, as it is there in antimicrobials. Same is true with parasitic infections. That is why integrated approach is very, very important. Diagnostic innovation, of course, enable targeted effective interventions, wildlife and zoo animals. They can provide the clues regarding warning which type of infections they may be emerging threats. We have to take care of this. Capacity building programs and interdisciplinary collaboration are fundamental. Way forward, success in maintaining parasitic diseases requires sustained collaboration among veterinarians, agriculturists, public health professionals, environmental scientists, and policymakers. Experience demonstrates that integrated, evidence-based, because of our research we have concluded something, can enhance both animal productivity and human well-being while protecting environmental health. So, I will conclude that man is strong, we know it, and clever. But the parasites, they are stronger and cleverer. Man will try to eliminate the parasites, but the nature, the creator of the parasites, wants them to exist. Then what we should do? In the nature, man, animal and parasites will continue to coexist. And our effort should be to limit this coexistence below economically significant threshold. We are not trying to eliminate the parasite, which is true in case of other bacterial and viral pathogen microorganisms, not in parasites. That is impossible. We are trying to manage them sustainably up to the low threshold level. I am thankful to all my colleagues and collaborators, such as from abroad, due to which it was possible to accomplish our research on parasitic diseases and leading to some conclusions. So if we work together like this, we are able to eliminate the parasitic diseases by all integrating methods, taking into account the environment, taking into account the animal health, taking into account the animal welfare. We can have more productivity. Our animals will be happy. Our farmer will be happy. Livestock owners will be happy. And at the same time, we will be able to have a sustainable control and more productivity from the animals. And we can save the environment. Thank you so much.